Good afternoon and welcome to this Facebook Live event from the Bonheur Children's Hospital in Memphis, Tennessee. My name is Jay Lieberman. I am one of the allergists and immunologists on staff here at Bonheur, and with us is Dr. Win Wong from St. Jude Children's Research Hospital. Today we will be covering the topic of newborn screening and how our roles play into that. We'll also be answering questions along the way, so if you have any questions, please do not hesitate to write them in and we'll be happy to answer them. I am an allergist and immunologist here on staff at Bonheur, and my role with the newborn screening program is that we are the screening center, the regional center for West Tennessee for all cases that screen positive for a disease called severe combined immune deficiency. This is a deficiency of the immune system that is present at birth and can be life-threatening. Tennessee started screening for this disease starting in 2016. And if patients screen positive and are found to have the disease, they go on to our collaborators at St. Jude, where they'll receive a life-saving procedure called a bone marrow or stem cell transplant. And Dr. Wong is going to let you know what he does in regard to the newborn screening program as well.
Hi, I'm Win Wong. I'm a pediatric hematologist. I take care of children with blood diseases that are non-malignant. And I work at St. Jude and have been there for 38 years now. Among our patients, the largest group has sickle cell disease, and that's one of the main conditions that's being screened for by the Tennessee newborn. Sickle cell disease accounts for about 800 to 900 patients at our center, and newborns are primarily from western Tennessee and northern Mississippi, and they are seen by us at the rate of about 45 new cases per year. I'll be talking a little bit more about newborn screening as we go along, and I'll be happy to answer questions as well.
So one of the things I think that would be important to start off is just kind of go over what is newborn screening. So every state has a different list of disorders and conditions that they screen for. The majority are similar throughout every state. And I think we were just talking about it. There are approximately 12 categories of diseases that Tennessee currently screens for. And whether you know it or not, if you've had a child born in Tennessee, your child has had this test done. Typically, this test is done by getting a very small amount of blood from the infant's heel right after birth. This little card that they put the blood on is then sent off to centers within the state, and that tiny amount of blood is then screened for each of these diseases that we are trying to detect. The idea of screening is to detect these diseases early and to screen for diseases in which we can make a difference if we find that the child has the disease.
And I'll give you a little bit of background about hemoglobinopathy screening, which is the test that is done to make a diagnosis of sickle cell disease. Back in the mid to late 1980s, a study was done that looked at the use of prophylactic penicillin in very young children with sickle cell disease. And it was found that by giving penicillin on a regular basis over the first 5 years of life, the chances of that infant with sickle cell disease having a fatal or very severe infection with a type of bacteria called pneumococcus could be greatly lowered. And in fact, that has led to a marked decrease in mortality from sickle cell disease in the first 5 years of life. But what this study led to was an indication for doing newborn screening of sickle cell disease very early in life that would then allow providers to prescribe penicillin for these infants that would then, and has been shown that since then, to lead to a greatly reduced risk of having this fatal infection.
All right, I think we have our first question here. It says, if my child tests positive for any of the conditions screened for, how will I be notified? So a great question. You will be notified in more than one way, actually. So the state will send notices to the local genetics team who is in charge of that region. They will also send a letter to the pediatrician or family doctor or primary care provider you have listed or is thought to be the primary care provider for your child. And lastly, they should send a note to you at your home address that you had listed during the hospitalization or on file for that child. And in addition, I'm not sure, Dr. Wong can tell you if he knows what they do for sickle cell disease. If a child screens positive for severe combined immune deficiency, it'll come to our office, and someone from our office will then contact the family and schedule them to come into our office to go over this and then to send off the confirmatory testing to make sure this child does or does not have the condition.
And in the sickle cell field, we have a very similar process to what Dr. Lieberman was just describing. We actually have a contract with the health department in Tennessee and also one in Mississippi, in which we're responsible for making a definitive diagnosis and following up patients who have a possible diagnosis of sickle cell disease in those two areas. And our team of sickle cell providers at St. Jude will contact the families of those patients who have a presumptive diagnosis of sickle cell disease. They'll be seen in our clinic, and a definitive diagnosis or confirmatory diagnosis will then be made. And if they do have sickle cell disease, almost all of them continue to be followed by our sickle cell program at St. Jude.
And I think a great point that you said, presumptive diagnosis, because I do want to let parents know, if you get one of these letters, please do not freak out. Calm down. Many of the cases that we pick up, and at least for severe combined immune deficiency, the child ends up being completely normal. There's nothing wrong with the child. And so many a times there's nothing to worry about. And if there is anything picked up by it, you'll be at a referral center in which there will be experts to treat that condition. All right, this question says, what conditions are screened for at birth? So you can go ahead and take this one, Dr. Wong, and I'll be happy to fill in.
So I don't know every single one, but historically, phenylketonuria, hypothyroidism, and hemoglobinopathies, including sickle cell disease, were the first ones that were tested for by the Tennessee Newborn Screening Office. And since then, there have been a lot of additional genetic conditions that have been added, including SCID, as Dr. Lieberman was saying. And they include a variety of metabolic conditions and things like cystic fibrosis, which is, of course, very important to diagnose.
And there are now some other endocrinologic abnormalities as well as some cardiac abnormalities as well that I believe Tennessee screens for now. So it's a myriad of conditions, and the idea being that all of these conditions, if detected early, will have a great impact if you detect it early and follow the treatment early on.
So I was handed the next question, which says, what is SCID? But I will give that to the SCID expert.
No problem. So SCID, S-C-I-D, is the acronym for the condition known as severe combined immune deficiency. So in lay speak, this is the bubble boy disease. So there was a movie in the 1970s, if you're old enough to remember, that starred John Travolta, which was a true story of a child born with this condition who was born with a deficient immune system. And therefore, in order to protect that child before we had definitive curative therapies, the child was literally kept in a bubble to keep out bacteria, viruses, fungus from attacking this child's body. Fortunately, now we can not only treat this condition, but we can screen for it with newborn screening, and we've shown that, our researchers have shown that the earlier you treat it, the much better the outcomes. And so essentially, these children are born without an immune system. Most importantly, they're born without certain cells called T cells. And when you do not have these cells, you are at very high risk for severe infections early in life, within the first few months of life. And now the curative therapies include some are medical, but typically most of these patients get what's called a hematopoietic stem cell transplant, or a stem cell transplant, or a bone marrow transplant, in which we restore, the physicians restore the child's immune system. And that can be curative for most of these patients. All right. Do all states screen for SCID at birth? That's a great question. I haven't looked it up recently. As far as I know, there are currently all but 5 states are screening, 3 of which I think are implementing screening this year or next. And I think there are only 2 states in the United States currently that do not have implementation plans to screen for this disease within the next year or 2. That can be found online through many websites, though, if you have more interest in that.
And I'll just jump in here and say that all states now screen for sickle cell disease. This became this universal screening became implemented in the early 2000s, and even those states which have very low sickle cell populations do screening now. So this question is, how do you get sickle cell disease? And that's also a very good question. Sickle cell disease is a genetic condition that's inherited. In most cases, not all cases, but most cases, the hemoglobin S gene, or the gene for sickle cell, comes from each parent. So the most common situation is that both mother and father have what's called sickle cell trait, and they happen to pass on to their child the sickle gene, or S gene. There are other forms of sickle cell disease, such as hemoglobin SC disease or hemoglobin S beta thalassemia, which are also genetically inherited. And they're a little bit less common than the SS form of sickle cell disease.
Dr. Wong, is it true that sickle cell may protect from malaria? And I've heard that in the past. Is that correct?
Yes, that's the major theory of why the sickle cell gene became prevalent in certain parts of the world. Those parts of the world being places where malaria is or was endemic. And the largest area actually is sub-Saharan Africa, which is where, if you take a global perspective, where the largest by far number of sickle cell babies are born. But sickle cell disease also has a high prevalence in India, certain regions of India, and it's also seen in Mediterranean countries and in the Near East. The occurrence of sickle cell disease in the United States has resulted from migration, or actually mostly slave importation that occurred historically from African countries to the United States. And the next question is also a good one. Can sickle cell disease be cured? And the answer is perhaps. Let me rephrase that. It can be cured by bone marrow transplantation. The proportion of patients with sickle cell disease who receive a bone marrow transplant, though, remains quite low, and there have only been roughly 1,000 cases of sickle cell disease that have been transplanted in the world up to this point. What's potentially happening in the future is gene therapy for sickle cell disease, just like for SCID, which, if it proves to be safe and effective, could result in a cure for large numbers of patients, but that's still a ways down the road. The other major treatments for sickle cell disease are the drug hydroxyurea and the use of chronic transfusion, and I can get into those areas a little later if needed.
All right. If I have a child with SCID, will my future children have it too? Oh, great question. So it's not a all-in-one answer, unfortunately, because SCID is essentially what we'd call a phenotype, meaning it's a presentation of a disease, but there are multiple genetic abnormalities that cause SCID. So it depends on what the genetic abnormality that caused SCID in your child is to know the risks of future children. So the risk could be as low as 25% for future children, or it could be as high as 100%, depending on what the mutation is. And so now, with the advent of SCID, it's great because, with the advent of newborn screening, it's great because we can diagnose these children very early on, and we can do the genetic analysis very early on, and thus allow the parents to know risk of future children of having the same disease, and of the child's risk of passing it on to their children as well. And how is SCID treated? So there are 3 ways that SCID is currently treated, depending on what that genetic abnormality is. So if you have one type of SCID, specifically it's called adenosine deaminase deficiency, or ADA SCID, this can actually be treated currently by replacing that enzyme with injections of the enzyme into the child. It's the only form of SCID that can be treated that way. The other way that is new is gene therapy. So there's ongoing trials at St. Jude, as well as some other locations in the country for 2 forms of SCID, ADA SCID, as well as what's called the X-linked form of SCID, which is the most common form of SCID. So gene therapy seems to be a possible future therapy for some types of SCID. And lastly, as we talked about, it's bone marrow transplant or stem cell transplant, which means getting cells that will turn into T cells that will repopulate the child's immune system, getting them from another source such as a relative, and infusing those into the child.
Here's a question about newborn screening. It's how do they decide what to screen for? And I think that's a complicated question because it depends on what conditions can be tested through the newborn screening process, and what conditions can be alleviated if the diagnosis is made in the newborn setting. I think there's also financial considerations, because some of these tests can be fairly expensive, and there is, well, that is why across different states the newborn screening process is somewhat variable. But as Dr. Lieberman said, and as I've said, the conditions that we're primarily focused on here are being screened for in almost all states.
All right, our next question. If my child tests negative for SCID at birth, can he or she develop SCID later on in life? It's a good question. That would be, while your child can definitely have other forms of immune deficiency that would not be picked up by this screening, it's very, very, very unlikely that your child would develop SCID later on in life if they screen negative. But we definitely diagnose many other forms of immune deficiencies that can be similar to SCID, and those can be, start to manifest in the first year of life or second year of life, or even later on in life with multiple infections, etc. So other forms of immune deficiency, I would say yes, but it'd be very unlikely for a patient to develop SCID if they screen negative for it at birth. Okay. What do I do if my child tests positive for SCID at birth? There's some very few things. So like I said, hopefully we would get that child in within a few weeks of life to get the confirmatory testing. The confirmatory testing is often normal. So many of those patients who screen positive for SCID will not actually have SCID. If you do get a notice saying your child has screened positive for SCID, there's some easy little things I would recommend you do. Number one, notify your pediatrician or family doctor if they haven't already been notified. The little things we recommend doing are not getting live vaccinations. Luckily, you don't get live vaccination until 2 months of life, so typically we will have figured out whether the child will have SCID or not by 2 months, and you don't have to worry about that. I also recommend, at our center, if they screen positive, we don't recommend they come into the hospital or anything like that, but I do recommend that you keep them away from any sick contacts. So most of these kids we will have diagnosed before 2 months of age, so it's not typically a problem, but no daycare, obviously. Keep them out of the church, daycare for the first 2 months until we can get the confirmatory testing done. Don't let, Uncle Joe come over if he's got an active cold. And limit other contacts in public. But fortunately, like I said, by 2 months of age, we should be able to have an answer, and it shouldn't be too much of a big deal.
So the next question is, who is most at risk for sickle cell, and how common is it in Memphis? The population that's mostly at risk in our setting here in Memphis is the African American population, or African population. The occurrence of sickle cell trait in the African American population is roughly 1 in 12. That means, if you do a little bit of genetic calculation, that a couple at risk for sickle cell disease, or at risk of having a child with sickle cell disease, is roughly 1 in 12 times 1 in 12, or 1 in 144. And then out of that proportion, about 1 in 4 would be expected to have sickle cell disease among their offspring. So roughly, actually the numbers are a little bit different, but approximately 1 in 400 African American births in Memphis or anywhere in the U.S. Would be expected to have sickle cell disease. So that translates into roughly 1,000, this is a very approximate number, but roughly 1,000 patients with sickle cell disease in Shelby County, based on the African American population here.
That's some good quick math.
Well, I've rehearsed it before.
All right. You want to go ahead?
So this question is, what kind of doctor treats sickle cell disease? And that varies by what's available and what country you're in and what part of the country you're in. But I can address this in the United States. In the areas where there are large sickle cell populations, there are hematologists who have a primary interest in sickle cell disease and care for the majority of sickle cell patients. In other areas, where sickle cell disease is generally not as common, patients are often cared for by generalists, such as family practitioners. And hopefully they've had training in management of sickle cell disease, or have attended sessions where there is information about sickle cell disease given to general practitioners. Sickle cell disease is also seen fairly frequently in emergency room settings, and there it also there the provider also varies according to whether there's a lot of sickle cell disease in the community or not so much. In settings like Africa, sub-Saharan Africa in particular, there is a real shortage of doctors with expertise in sickle cell disease, but fortunately that is currently improving, as is the case really on a global scale.
And so this is along the same lines, what kind of doctors treat SCID? So usually that's going to be what we would call a multidisciplinary team. Hopefully you would be at a center, if your child's diagnosed with SCID, at a center that has some expertise or experience treating these patients. Most centers will have multiple physicians, including an immunologist, possibly an infectious disease doctor, and definitely a transplant doctor. And the transplant doctor is typically going to be someone who is trained in pediatric hematology oncology and has an interest in treating this. At some centers, all those doctors will continue to follow the patient after they've gotten treatment. At some centers, perhaps the oncologist, who's a pediatric oncologist, will treat them for, first 10 years or 18 years of life, and then they'll transition to an immunologist. And as an immunologist, most of the immunologists are board certified to treat both pediatrics and adults, so they can take care of the patient as they transition from childhood to adulthood. All right. Who is most at risk for SCID? Unfortunately, there isn't a defined population that would be at risk. Obviously, if there's a family who has had one child with SCID, that would suggest that they are more likely to have more children with SCID. And there might be higher incidence of SCID in certain populations in which there is small villages or what we would call consanguinity, or marriage within families or between families. But other than that, it would be pretty random, and I couldn't give you anyone that would be specifically at risk. And then the last one is, how common is SCID? I unfortunately am not as bright as Dr. Wong, and I can't give you exact numbers. It still remains very, very rare, and what I can tell you in our center in West Tennessee, we have been screening for the past, since 2016, so this would be the third year of screening, and true SCID cases during that time, we've only had one. So I think the numbers are going to be somewhat dependent on where you are. My child was not screened for SCID at birth. What symptoms should I look for? So the most common presentation for a child with SCID is not recurrent infection. It's actually the child is not growing well. It's a very fussy child. They often present with severe rash and often diarrhea. These are children, and it's not a mild rash. Quite ill, and it may not be an overt infection. They may not have an obvious pneumonia causing it. Perhaps they're getting mild infections that are leading to this. If your child is in the hospital with severe rash and malnutrition and diarrhea, that's typically when we would start screening. Or if they do get, an odd infection within the first couple months of life, that's how we would start looking for this. If your child's reached, 2 years of age, it's very, very unlikely that they would have severe combined immune deficiency.
So this question is, where can I get more information about sickle cell disease? There are a number of websites where information can be obtained, and one of them is stjude.org/sickle cell, and that is the site where we would also be able to provide some brochures that are educational about sickle cell disease, about treatment with hydroxyurea, about treatment with transfusions, and about bone marrow transplant. Another site is sicklecelldisease.org, which is a site of the Sickle Cell Disease Association of America, a national organization that provides information and supports research on sickle cell disease across the country. There's also a Methodist site. However, when I just checked it, it was not up, so I can't give you that right now. And there's also an organization that's local, that's called the, local and regional, called the Sickle Cell Foundation of Tennessee. And I don't have their email address, but if you just look for the Sickle Cell Foundation of Tennessee, you can find their information. I also have one more brochure that that reminded me that I should have mentioned that in the course of testing for sickle cell disease through newborn screening, a lot of persons are identified with hemoglobin S trait or sickle cell trait, which is in general, it's a benign condition, and its major importance is to be the basis for counseling of families about their risk of having children with sickle cell disease, and counseling families, and then ultimately counseling children as they're old enough to understand how the genetic inheritance works. And we do have informational brochures about sickle cell trait as well. I should also mention that sickle cell trait is actually much more common than sickle cell disease. It's about 1 in 12 in the African American population, smaller in the Hispanic population, and very small in the Caucasian population. But there are cases that do occur there as well.
Okay. Where can I get more information about SCID? So there's a few online resources that I would recommend. Primaryimmune.org is an excellent resource for patients and families. SCID.net is another one. And St. Jude has a nice piece on their website as well at stjude.org/SCID or SCID. And obviously, if you have any questions regarding it that you don't have on these resources, please feel free to contact us, and we're always more than happy to discuss it. Last question, I'm told. Newborn screening. Where can I get more information about newborn screening? So a couple places. CDC.gov, I think it's /newborn screening, has some excellent information on there. They would be able to tell you what your state tests for, what are the specific diseases, and what are the the odds of well.
And if you just contact or just Google newborn screening in Tennessee, you can get a lot of information from their website.
So I think that is all the questions we had. We thank you so much for tuning in, and we hope you join us next time on our next FB Live event.